Daily removal of dental plaque is the primary method for preventing cavities and gum diseases. Clean all tooth surfaces with a toothbrush using vertical sweeping motions. An end-tufted brush helps remove dental plaque in hard-to-reach areas. A toothbrush cannot adequately clean narrow spaces between the teeth. To clean the proximal surfaces, use dental floss. Carefully insert a short section of floss into the interdental space, gently moving slightly under the gum line. Clean the two adjacent tooth surfaces with sliding motions. An interdental brush can also effectively clean such areas. Carefully insert it between the teeth and make 3 to 4 back and forth cleaning motions. An oral irrigator helps remove food debris between teeth and supports hygiene in the area of gum pockets and prostheses. Remember that dental plaque cannot be removed using a water stream, as it adheres tightly to the tooth surface. A tongue scraper or a soft brush helps remove food debris and plaque from the tongue and contributes to fresh breath.